Is dental treatment feasible in patients on high-dose antiresorptive medication? This is the question I want to answer in my presentation entitled Dental Rehabilitation of Cancer Patients with Bone Metastases on High-Dose Antiresorptives. My name is Camilla Ottesen, and I'm a PhD student and a dentist here in Copenhagen in Denmark. I work at the Department of Oral Rehabilitation, Copenhagen University, and also at the Department of Oral and Maxillofacial Surgery, Copenhagen University Hospital. I will now tell you about patients in bisphosphonate and denosumab therapy, together known as antiresorptive medication. It's this bone strengthening medicine, which is really important for a lot of patients worldwide, but which may cause some troubles for you and for me in our daily work with dental implants. This study is supported with implants free of charge by Straumann and economically funded from Amgen and the Danish Dental Association. Today, dental implant treatment is considered contraindicated in patients on high-dose antiresorptive medication due to the risk of medication-related osteonecrosis of the jaw. This is a true statement, and it is followed at department worldwide, which means that every single patient, old or young, healthy or sick, have to make a choice if he or she lose a tooth or several teeth. A choice between fixed prosthodontics, could be a bridge, which may damage some healthy neighbor teeth. It could also be removable prosthodontics, but actually a denture is seen as a risk indicator for osteonecrosis itself due to the risk of trauma on the mucosa, or it could be no treatment at all. Let's have a look at this young patient. She's 47 years old. She's diagnosed with multiple myeloma.